Right Honorable Raila Odinga, Your Excellency James Ongwae, other excellencies present, all protocols observed. Good morning, everyone. I'm here to summarize highlights of possible solutions that have been discussed in this forum since we started yesterday. We could start. We talked a lot around leadership and governance, and some of the possible solutions that were proposed is that institutions need to review their organization structures and ensure they're able to deliver their mandate in an open and accountable manner. I think a lot has been spoken about the leakages we are having, and if we've sealed all those loopholes, perhaps we'd even have much more resources to invest in the health pillar. There has been a lot of talk around collaboration and dialogue among all the stakeholders, starting at the executive level, the CECs, the CEOs, the CDH, and others, including the legislative county assemblies and the committees on health. We've heard a lot about the need to have the right policies to attract investment, and also interaction and collaboration and dialogue among all cadres of the health workers. There has also been a lot of talk around the performance management, where we are calling for mutual accountability for results, quality improvement, and cost containment. And I think also this morning there was an emphasis on having output-based results and impact in assessing the impact of our service delivery in the health sector. When it comes to service delivery in health, I think the Lake region will require to invest in specialist hospitals. We've already started to see all their talks or there is effort towards having centers of excellences. For example, where Kisii is specializing in cancer, Kisumu on orthopedics, and Kakamega on mental health. Through that, we'll also develop the sharing of the resources, which we acknowledge is one of our scarce resources. And this one, I think there has been talk around how we can become innovative in terms of how we pull into our specialist skills through medicine, use of technology. There's also talk about the digitalization of the medical reports and all that will help people share in information and solutions in case of the cases noted. I think a lot has also been said about the need to have due emphasis placed on preventative and promotive health efforts, rather than having too much effort or focus on curative. And in there, actually, there was talk about involving different sectors, having a multi-sectoral approach. We had about education, where we're going back to train our people on the need to wash our hands properly, agriculture, water and sanitation, as well as environment. There's also health information and ICT infrastructure. I think there's already a lot of effort going on, and Palladium is leading that in terms of how ICT or health information system can be enhanced and adopted in the region. So I think there is need to take that on board. And obviously the use of paperless systems, and I think Busia County is leading this. They are on a trial. The central data collection and analytics for the region. This morning we've been talking about the need for research. And data collection and analyzing of the cases we are seeing in the region will help us come with the right solution that will help address the issues before they actually reach us or hit us. And somebody also did mention the use of iCloud, and that will help in the computerization or digitalization of the information. I've talked about the use of telemedicine as proposed by Dr. Kegondi yesterday. I think it's something we need to embrace. And as I conclude, a lot has also been talked about the healthcare financing. And there was a request to NHIF to consider accrediting other health facilities besides the level 4 hospitals, so that the NHIF cards can also be acceptable or accepted by all the population. There is also a quick win that came up in terms of there's a group willing to talk about or to run with the setup of a manufacturing plant for health products in the region, and that could save us a lot of money. And then also there is a group that is willing to take on the mentorship on how to go about building business case to attract investors in our region. I think that's also a possible quick solution that can be adopted. A lot also was spoken around the human resource for health, and this touched a lot about the proper incentives for all our health workers. So just to ensure that nothing is left or forgotten in this workshop, perhaps Dr. Amanche can take this on board and see how perhaps she can come up with a work group to move this forward by ensuring that there's an implementation plan that will have timelines and ownership. And one of the forum I thought is what Dr. Amit was talking about, the county stakeholders forum. That could perhaps help in moving forward and actualizing all what we've been discussing in the last 2 days. Thank you very much.
Thank you very much. Another round of applause to Madam Benedict Waholga, please. Thank you. Chief guest, distinguished ladies and gentlemen, to talk about health investment opportunities within Lake region, please help me welcome the Honorable Professor Sam Ongeri. Another round of applause for Honorable Professor Sam Ongeri. Thank you.
Thank you very much. Right Honorable Prime Minister, Your Excellency Governor Ngwai, Your Excellencies the governors represented here, ladies and gentlemen, I know we're constrained in time and all protocol observed. I thought I should just make a snapshot of 1 or 2 things that we need to be able to look at quite instinctively. Please allow me to begin by congratulating all the officers from Kisii County and all other counties who are involved in the successful organization of this significant conference. Only a healthy people can produce wealth, for in sickness, families lose, society coughs, and the economy fails or falls. It was with great wisdom that the Constitution provided for the function to be devolved and the services closer to the people. And if one was to be a casual check across, to do a casual check across the 13 counties represented here today, the greatest strides have been made in the health sector. For instance, in Kisii County Level 6 Hospital, we have seen major facelifts and ongoing construction of additional wards, and such stories are true from Trans Nzoia to Kericho, Bomet, to Migori, and it's a testimony to what devolution can do for our people when all stakeholders play their rightful role. Whereas a lot has been achieved, a lot more needs to be done, as we are a developing nation that is still ravaged by the communicable and non-communicable diseases. The effects of HIV/AIDS especially ravaged our Great Lake regions, with the latest survey showing that our counties still have a lot to do in bringing down the prevalence rates and reducing new infection rates. For the purposes of this session, allow me to share with you my thoughts and my mind on the investment opportunities that exist to be exploited within our counties. As an academician in the field of health, one area that remains largely untapped is that of research and development. In the developed world, research is a billion-dollar industry, as all development in all spheres of life is anchored, and rightly so, on research. The 13 counties need to consider coming together and teaming up to set up a world-class health research center where local and international researchers can benefit in their quest for knowledge. A credible research center of excellence portends many opportunities for our counties, our health professionals, and can position us as a critical partner with the world-leading pharmaceutical industries and other research centers globally such as the World Health Organization and the CDC, etc., etc. Another key area that has been untapped is the public-private partnerships in setting up specialized modern centers that focus on a particular health need for the benefit of our communities. Of immediate mention is for the 13 counties to consider strategically positioning cancer centers, eye centers, mental health centers, diagnostic centers, and even modern rehabilitation centers to cater for the young people suffering from alcoholism and other addictions. Such an arrangement will ensure that we streamline our competing resources where they are needed most and allow us to share facilities that will otherwise not make economic sense if we go it alone. I must also bring to your attention to the fact the value of the African pharmaceutical market in 2013 was $20.8 billion. And this figure is expected to soar up to $60 billion by 2020, according to the African Business Magazine. We must and definitely should strategically position our counties to seek a stake of this booming industry. We should carry out a joint feasibility study on the viability of a major pharmaceutical industry in the Great Lake regions. If Africa is to rise up, then we must become producers rather than consumers. And what better place to start than in the vibrant health sector? The Englishman says poverty is the mother of innovation. You've already heard about it. And because of this, we've seen great countries like Cuba producing molecules for the manufacture of antiretroviral drugs. And I should say that one of the areas I'll just enumerate, my speech will be available for reading, is that we must seek the potential areas for possible investment with regards to technology that include electronic record management, and I think you've heard that, self-service e-kiosks, where patients avoid queues and register themselves and can be on the end of the line and receive the medicines, using mobile telephony application to conduct health checks and even allow medical personnel to order prescriptions via smartphones, and educating the citizenry on key health messages. It's cost-effective through the simple telephone. 90% of our people are already on telephony, and therefore we can be able to get across health messages at cost-effective prices. And enhance telemedicine. And I know we used this telemedicine in 1953 in Uganda when they had a problem. We used telemedicine with Nairobi University and the Canada University to be able to deliver the key diagnostic processes through this telemedicine. And this can now be done at the county level to your peripheral centers. And it's a worthwhile investment. And as I said earlier, farmers do play an important role in nutrition and many others. And of course, the exploitation of indigenous products, the indigenous flora and fauna, which is important for the manufacture of the indigenous drugs. I could have gone on because of time constraints. Let me leave it there. There is a cupful for research programs within the county, and if we do, we shall be very successful. God bless you.
Thank you very much. Another round of applause to Professor Samongeri, please. And now, ladies and gentlemen, to give another adoption of the final communique overview and also to take over to with the remainder of the program, please help me welcome our host, His Excellency James Ongwae. Another round of applause to His Excellency James Ongwae, ladies and gentlemen. Thank you very much. Thank you. Welcome, Your Excellency.
Thank you very much, MC, and thank you for the management that you have done during the day. Your Excellency, Right Honorable Prime Minister Raila Amolo Odinga, Excellency Governor Ranguma, Jack Ranguma from Kisumu, Excellency Governor John Nyagarama from Nyamira, Excellency Governor Cyprian Awiti from Homa Bay, Deputy Governor Tima from Kakamega, Honorable Janet Ongera, our good senator, who is part of the Senate delegation from Kisii in our parliament in Nairobi, our Speaker of the Kisii County Assembly, Honorable Kerosi Ondieki, and all the MCAs present, ladies and gentlemen, on behalf of Kisii County, Your Excellency, I tell you I'm extremely happy, and I can assure you all the Kisiis and all the other people who are here are happy that you are able to grace this occasion, which is an occasion for the Lake Region Economic Bloc, where we all came together, 13 counties, and accepted the reality that we have serious problems in our counties. Unfortunately for us, Honorable Prime Minister, you come from those counties that have problems. Just to give you an example of some of those problems, yesterday we had Dr. Kamarogo from the World Bank, and he told us two things. He said these counties have over 50, in fact over 50, close to 60% of the doctors in this country. But he also said that these counties also have the biggest burden of disease. So they export two things. They export doctors, and they also export patients out of this region. The irony of that is that if we have the bulk of the doctors who are working out here, we take our patients to other regions, and we are even exporting resources actually to those regions, because the patients we take, we have to go and pay there, Your Excellency. In the region, very, very quickly, we identified 7 pillars to drive development, our development agenda, which were agriculture, tourism, education, health, financial services, ICT, and infrastructure. And these were being led by various counties. Kisii County was given the honor of leading the health sector, and that is why we are here. Your Excellency, as we are here as part of the Lake Basin, we must accept the reality that this country cannot be developed by government. In fact, the governments don't develop themselves. This country must be developed by our own people. We must have a sense of collaboration with the private sector, and that is the knowledge that brings us here. And we've come here in the context of healthcare systems. In fact, the theme of this conference is strengthening healthcare systems through partnerships in socio-economic prosperity, which means that we must work together. And that's why I liked what Professor Ongeri, for those of you who don't know him, he started being a doctor in this country, I think, in the middle 60s, 64, 65, rose through the ranks to become a professor of medicine, and now is, of course, in politics. But he said something, he said about telemedicine, which is one of the things that you discussed here, and I'll give you a very simple example. In Kisii store, we have an MRI, a magnetic resonance imaging equipment, which is probably one of the best machines in this region. But we do not have a radiologist there. We are collaborating with the private sector. We send the results to Nairobi, and the turnaround period is 5 minutes. In fact, it could be quicker than somebody who is sitting in that room. And that's what we are talking about. If these counties here can collaborate, even in the context of the human resources, the professionals that we have in the various areas of medicine, in terms of giving information, that's what we are talking about, Your Excellency, in this conference. We are also looking at management of healthcare facilities, human resources for health, legal procedures in healthcare, healthcare financing, ICT and healthcare, infrastructure for health, research, information, and development. I don't want to spend too much time because we are on a short timeline, but I want to tell you that you are welcome here. You're part of this region, and as you converse, I know you travel a lot, you are invited to other countries. Please remember where you come from. Here in Kisii, we have a saying that if you are If you want to clean your house, you don't start cleaning from outside towards the house. You clean from inside the house outwards. So we are informing you, we are asking you, Honorable Prime Minister, as you travel the world, please remember where you came from, that you came from this region. With those few remarks, ladies and gentlemen, please allow me to invite our colleagues to say a few words. We are running out of time. Today is budget day. You all know that. I will now invite Mr. Speaker, sir, and the members of the County Assembly. You will please allow that we are not going to ask the Speaker to speak because we are on a limited time, but we have recognized him and we recognize yourselves. I would ask the Deputy Governor of Kakamega, please come in and just say one or two words, please.
Your Excellency, the party leader, Honorable Raila Odinga, His Excellency the Governor, Kisii County, Honorable James Ongwae, the Governor, Nyamira, Honorable Nyangarima, all the other governors present, the Senator present. On behalf of Kakamega, I would like to say thank you very much for coming. The governor was supposed to be here, but he's not here with us. He sent me yesterday, I was here. I chaired a session, and I remained here so that at least I could be with His Excellency, Honorable Raila Odinga. And in Kakamega, we assure you that we are fully ODM. Thank you very much.
Thank you very much. The next speaker, please avoid the salutations. We will accept that fact. Can I please ask, the next one is Janet Ongera, our senator. Please clap for this lady. She has fought for herself. She was not voted for. She has fought for everything in this life. Up, Senator. Clap for her once more.
Thank you very much, Your Excellency. Your Excellency, our party leader, the Prime Minister, Raila Amolo Odinga, all protocols observed. I just want first to congratulate all the counties in the Lake Region block for having such a wonderful conference. Health, it is said that a health nation will be more productive and it will produce a higher GPD. All I would like to say that we in the Senate will continue supporting more investment in health. We are going to continue allocating more resources so that we can have more clinics, more health facilities constructed. We are particularly passionate that we should have more clinics in the rural areas for reproductive health rights, for prenatal and postnatal care, so that our mothers cannot die giving birth. Thank you very much.
Thank you very much, our good senator. Can I now ask the good governor and my brother, John Nyagarama, His Excellency John Nyagarama, the governor of Nyamira. Please clap for our governor. I've seen this young man grow. We were in the same school.
Thank you very much. Your Excellency, former Prime Minister, and all protocol observed. I've been advised to be as brief as possible. I want also to join my colleagues in saying that we are ever forward and that we're doing everything possible to make sure that the Lake region becomes of value to our people. Thank you very much, and may God bless
Thank you very much, and please pass our greetings and the greetings of the Right Honorable Prime Minister of the people of Nyamira. His Excellency Honorable Awiti, the Governor of Homa Bay, Jatelo mar Homa Bay,
Your Excellency, Prime Minister of the Republic of Kenya, Right Honorable Raila Amolo Odinga, and the next president of this country. All protocols observed. Mine is to say that we are most privileged and happy that the king of devolution is sitting here. The person who came up, who dreamed one day and night that devolution should come to Kenya. Today we are reaching, Your Excellency, the marginalized, the hard to reach, the very, very poor, and the poor people in this county and this country. And we in the region, we can assure you, health being a key issue, a key area, we are doing everything and determined to ensure that health of our people are improved. We wish you the best of luck as you become the president of this country. We are sure you'll be able to give us more resources, do as much as possible. Thank you.
Thank you very much, Governor. It's my pleasure now to invite the Governor of Kisumu, the Governor of that great city of London, to come forward and say a few words also. Thank you very much.
Your Excellency Raila Amolo Odinga, Excellency is present. I'll be as brief as a miniskirt. Yesterday we were here to give direction to health in this region. And as you remember, I chair health in the Council of Governors, and in that committee, our role is to ensure that we implement devolution to the extent that it was intended for the fathers of devolution. And the real father of devolution is present here in your name, Your Excellency. And we discussed many things that we feel must help change health in Kenya generally, but most specifically because we agreed that we must begin at home. We have agreed on things that we must do here in the county of Kisumu. So I want to just thank you for finding time to come and share with us these views. I noted that you are listening very carefully to the summaries of the deliberations of yesterday and today, and that we are going to make things work in the manner that you intended them to work. So I just want to also thank my brother Honorable Ongwai, the reason being, as a leader of the health pillar in this region, we work closely together to ensure that health works and health works for our people. With those few remarks, I thank you.
Thank you very much, Governor. He is also the chair of the Lake Basin Economic Bloc, and he has guided us very well. And this inaugural conference is probably the first conference for the Lake Region Basin Bloc, Economic Bloc. And we are hoping, like I did say yesterday, that what we are institutionalizing is important. It has absolutely nothing to do with the political calendar. If we were following the political calendar, we will not be here. Because we are institutionalizing systems. I told you yesterday, most of us as human beings, we are transitory. And we must keep on working until the last day. So ladies and gentlemen, with those few remarks, it's now my pleasure and duty to ask you to be upstanding. Clap for our Prime Minister. Please come and talk to us, sir.
Haya, asante sana. Your Excellency, the Governor of Gusii County, Honorable James Ongwae. Your Excellencies, the other governors, distinguished guests, ladies and gentlemen, hamjambo. Hamjambo tena. Thank you very much. I'm very delighted to be here this morning and to see so many people from different parts of the Lake region gathered here at the Kisii University to talk about a very important sector in our economy, the health sector. I have a lot of respect for Professor Ongeri. And I listened very carefully when he was talking here. And I know that he would have preferred to have been a Minister for Health in a devolved system of government. Because he will tell you that devolution works. The old system, when he was a Minister for Health after there in Nairobi, he had to be minding all sorts of things. Something is not working somewhere in Kabarnet, somewhere there in Mandera, there in Lamu, in Kisii here. He had to attend to all those things personally as a Minister for Health. Now, with devolution, he doesn't have to. You need to talk to the governor, and things are okay. The only problem we have is the disconnect between the national and the county government. And that's what we want to fix. So, ladies and gentlemen, when we met here last year, met at a forum similar to this on February of last year, we were at the County Entrepreneurship Summit. That is what took place here at this university. We were looking into how to improve and to unleash the economic potential of Kisii County in collaboration with its neighbors. I am glad to be here today for what I consider to be a continuation of the conversation we started by narrowing down today to a specific and critical aspect of the well-being of our people, which is the health care. Devolution was meant to take the services and resources closer to the people. The most critical service Kenyans lack and badly need at the grassroots is affordable, quality health care. I wish to share my thoughts on some of the areas we need to prioritize in the next 5 years as we seek to join hands in delivering health care. At the pain of repetition, because I listened to some of the things that were being said yesterday, it will be like to try to emphasize some of those points. We need equity, universality, affordability, and equality in health sector. Equity and universality mean our expenditure in healthcare must prioritize the needs of the most vulnerable who suffer the largest burden of disease. This means prioritizing greater investment in access and protection measures for the poor. Improving equity and universality would mean some kind of affirmative action to reach the poorest and minimize disparity in access to health care on account of gender, social status, and geographical barriers. In this regard, we need to come up with a clear plan that informs, clarifies, and strengthens the role and hands of the county government in shaping the healthcare in all its dimensions. These dimensions include investment in organization and financing of healthcare services, prevention of diseases, and promotion of good health through cross-sectoral action, access to technologies, developing human resources, building the knowledge base required for better health, financial protection strategies, and regulation and legislation for healthcare. As we speak, Kenyans face extraordinary challenges with regard to accessing quality and affordable healthcare. Our people, especially those in rural areas, live one ailment away from the death or bankruptcy. The poor are the hardest hit naturally, but everyone is feeling the pain, including the middle class. The disease burden in the counties represented here is humbling, as has been ably articulated here during this conference. We have high rates of infant and child mortality, HIV, AIDS, and malaria, in addition to ailments like upper respiratory tract infections and pneumonia. Lifestyle diseases are rising across the country. These are diseases which come with affluence. The worst hit are those without health insurance. What these realities mean is that the time has come for our country to bring about a complete transformation of the health sector. Luckily, healthcare is a devolved function. This creates room for new thinking away from the old mindset that has bedeviled this critical sector since independence. I want to share some thoughts on what I believe counties could do going forward to ensure devolution delivers with regard to healthcare. I wish, however, to emphasize that some of these measures will require the goodwill and cooperation of the national government, which is currently lacking. A recent survey by the University of Nairobi found that about 17% of those who reported illness did not seek health care. More than 50% quoted lack of money as the main hindrance why they did not seek health care. Among those who utilized the health care, 12% experienced catastrophic expenditures, and some 4% of about 2.5 million individuals were impoverished or made poorer by these payments. The poor experience the highest incidence of catastrophic expenditures. The econometric analysis reveals that out-of-pocket expenditures are a deterrent to health service utilization, are significantly and positively associated with catastrophic expenditure and with household poverty. Time has come for Kenya to roll out a medical scheme, including health insurance, that is capable of delivering quality health care services to all our people, something akin to Obamacare in the United States. When Mr. Trump tried to repeal or change Obamacare, he found it very difficult because it became too popular with the people in the United States. In collaboration with the national government, counties need to embark on deliberate programs that raise the quality and affordability of health care, that increase the number of people with medical insurance. Time is long overdue for publicly financed health insurance schemes that will improve access to hospitalization services and protect households from high medical expenses. This will shield our people from the fraudulent measures that some hospitals and insurance companies have resorted to lately. And you see a number of people coming to you with prescriptions because they don't have money to go and buy those drugs. This will shield our people from the fraudulent measures. We must bridge the gap between the rural and urban population with regard to access to affordable healthcare facilities by building and managing hospitals and clinics in areas where majority of our people live. We should aim at ensuring that in the next 5 years, the big cities and urban centers won't be the only ones with access to excellent health facilities, and people won't have to travel from their villages in search of good doctors and hospitals. And I am very delighted to witness the effort being made by the counties in this region to bring Medicare affordable and accessible to the people. We must change the pattern of majority and the best healthcare facilities being located in major cities and urban centers where majority of population live in rural areas. This is a task county government must give priority. But access is not enough. One area in which we cannot afford to continue with the policies of exclusion is healthcare. As costs of Medicare rise, affordability must be addressed. We need medical systems and services that cater for the entire population, not just a targeted subgroup. The task of providing health care for all cannot be undertaken by the government acting alone. It requires participation of other sectors in the communities. It would also require the widest levels of partnership with academic institutions, not-for-profit agencies, but for commercial, private sector, and healthcare industry. Counties, therefore, need to create space for private sector to be involved in driving the growth of the country's healthcare sector. We also need to forge partnerships with local and foreign learning institutions. Our counties also need to partner with financial institutions to start specialized finance options for those looking to invest in the sector. We need to press banks to offer customized solutions to fit the needs of the doctors, diagnostics centers, hospitals, and nursing homes in the counties. This will enable more people to have access to great health care in the years to come. To meet the growing and changing healthcare needs of our people, our county government must be on the forefront transforming the health sector through investment in research, innovation, and technology. Some of the technological and innovative measures we could explore are investment in the e-health to provide effective, economical, and timely healthcare services to all individuals, and especially to those people who have little access to healthcare services. With e-health, citizens should get things like lab reports and doctor's appointments much easier and faster. Innovation and technology should see our counties develop e-hospital applications online registration system that allows patients to skip the hassles of registration and other formalities required at the hospitals. As we pursue this, we also need to create an infrastructure that would make it possible for medical personnel from advanced countries who wish to work in our countries to be able to do so with ease. Our aim should be to ensure low cost of treatment, quality healthcare infrastructure, and the availability of highly skilled medical personnel in public hospitals. Our healthcare sector is divided into the private sector and public sector. Private sector hospitals are frequented more often than government hospitals because they provide better services to patients. I want us to reverse this pattern in the coming 5 years. With appropriate investments, you can make government hospitals the facilities of choice for our citizens, or at least put them at par with the private ones. Overall, our overall aim should be to make Kenya a top destination for medical tourism in sub-Saharan Africa. We have seen many hiccups paralyze the health sector these past 4 years. For instance, governors were made to sign for health equipment that was clearly not a priority. Those hiccups were clearly the source of the standoff between doctors and the government that paralyzed the health sector. Going forward, we must seek ways to safeguard counties against such intrusions that turn upside down their priorities and their ability to deliver to the electorate. I wish to end by talking briefly about the recent doctor strike, which was a product of those many hiccups brought about by lack of clarity on the management of the health sector. The task force on strengthening of the health service delivery, established in the year 2012 under my direct direction as the Prime Minister of the Republic of Kenya, was part of a return to work formula following a doctor strike over a variety of grievances. So this is an issue I was very conversant with because I handled it as a Prime Minister. The task force came up with key building blocks for successful health system, including availability and functioning of diagnostic equipment, human resource management and capacity building, compensation of registrars on training, stewardship and management of public health institutions, financing of the public health sector, and performance management in the Ministry of Health. These goals remain valid. There remains a significant need for the establishment of a health service commission to help us realize these goals. A health service commission would free counties from the heavy responsibility of human resource management and allocation while allowing them to focus their resources and energies on managing health facilities, providing pharmaceutical services and medical supplies, and ensuring the availability and functionality of diagnostic equipment. A health services commission would further oversee capacity building. There are hundreds of unemployed Kenyan doctors looking for work. It is therefore disappointing that the government is seeking to recruit 500 foreign doctors to serve in our hospitals. We need to invest in resolving our policy problems in a way that leaves our citizens motivated and willing to serve our country. Over the weekend, I suggested that all governors ought to immediately honor the terms of the return to work formulas signed with the Kenya Medical Practitioners and Dentists Union and pay the health workers their arrears as from December. I am pleased to announce that this has been taken up by the Mombasa County government. I want to appeal to the county public service boards in all other counties to follow suit and pay doctors so that we can put this crisis behind us. This is money that was already budgeted for. And if they had been there, they would have been paid. The directive by the Ministry of Health to withhold pay amounts of bad faith and can only poison the waters, leading to poor service delivery for an inch. With these measures, you can look forward to a healthier Kenya in the coming few years. I wish you best of luck. Asanteni sana. Asanteni sana. Leo si siku ya siasa.
I am asking His Excellency the Prime Minister not to leave because we have a small present to give him. Our presents here, we normally give matoke, so I don't know whether you're the pilot of your craft will agree to take matoke into the helicopter. Those, yeah? Those who had presents, please bring them here.
Thank you. May I ask that we all be upstanding? Let's all be upstanding as the chief guest receives his present from His Excellency James Ongwae. Your Excellency, please give His Excellency, the Right Honorable Prime Minister, his present, please. Thank you, please.
This present, Your Excellency, the Prime Minister, is a shield. And you heard the governor of Homa Bay, you heard what he said about the presidency, and we are giving you a shield, and it's going to shield you. Thank you very much.
Sound testing 1 2. Mic levels testing 1 2.
As he hands over the present to our chief guest. Thank you very much. We now want to call upon Excellencies governors and the deputy governors, and of course with the Professor Samongeri and Senator Janet Ongera to please step forward to come at the fore and also to receive your presents, please. We may be seated, please. Thank you. Thank you very much. The Excellencies and the deputies and senators, thank you. Thank you very much. Your Excellencies, you may just line up here for your presence. Thank you, Excellencies. You may just step out the fore to receive your presents. And also Professor Samongeri and Senator Janet.